Hello everybody. So this is going to be our second video of the series of Ophthalmology of Stye. So our trick was not to tell the diagnosis. Instead, you should tell the features that you see in the picture, or you simply define the picture. Okay, if I show you this picture, how will you define it? Okay, this is very important, and this topic is literally won't leave you. Okay, it will come in every single exam. Okay. So if I want to describe this picture, I will say that I can see a lesion which is right on the lid margin. This is your lid margin, and on the lid margin you have a lesion. Lesion is not seen on the surface of the eyelid. Okay, if the lesion is seen on the surface of eyelid, your diagnosis will be changed. Okay, and if the lesion is present classically on the lid margin, your diagnosis will be different. Okay, so if I just zoom the picture, you can see this mucopurulent fluid within the lesion, right? You can see pus within the lesion. So you have to mention this, that I can see a lesion, a nodular lesion on the lid margin, and the lesion contains mucopurulent fluid inside of it. Okay, then you will say, I can see the eyelashes within the lesion. Can you see eyelashes within the lesion? This one over here is particularly in the lesion. Okay, in the lesion. So you have to mention this. Okay, and then you will mention that I can see some inflammatory changes. I can see erythema around the lesion, and some of it is present over the lesion as well. So this is how you will define this picture. And when they ask you about the diagnosis, you will say that my diagnosis will be Stye, okay, or Hordeolum externum. Okay, this is very important. Okay, let's just read the text together. Okay, so define the picture. There's a nodular lesion containing pus, which is known as pustule, seen at the lower eyelid margin. Okay, it is present on the eyelid margin. Please remember that Stye is present on eyelid margin, whereas chalazion is present on the lid surface. Let me show you chalazion that we did in the last video. Okay, this is chalazion. Chalazion is classically present on the lid surface, okay, and your Stye is present on the lid margin. And chalazion doesn't have any kind of pus, but Stye has, okay, pus in the lesion. Okay, the lesion has inflammation with erythema. Okay, eyelash is seen within the lesion. Okay, the lesion is on lower eyelid. Okay, one more differentiating feature. Stye can be on lower eyelid, whereas chalazion occurs at the upper eyelid mostly. Okay, and the chalazion is at the surface, whereas this lesion is at margin. And I can also see abscess, mucopurulent fluid in the nodule, indicating that there is infective agent. Okay, so what are your differential diagnoses? My first diagnosis, the diagnosis which I would like to keep on the top of the list, will be Stye or Hordeolum externum. Then I will also say that this might be Hordeolum internum. Okay, and this can also be secondary infected marginal chalazion. But this is Stye. Okay, your first diagnosis will be Stye. So to be on a safe side, always give the list of 2 or 3 diagnoses. Okay. So what is the etiology of Stye? Okay, let me explain this to you. Okay, if I ask you, what is a boil? What is boil or furuncle? You will say the boil is simply the infection of hair follicle. Okay, it can occur anywhere in your body, in your ear, in your nose. You have a hair follicle, right? You have a hair, and beneath that hair you have the hair follicle to which that hair is attached. If we get infection of this thing in a body, if we get infection of hair follicle, classically by Staph aureus, okay, Staph aureus, you will call this thing as a boil. Okay, it can occur in your nose, in your ear, anywhere in the body. So boil anywhere in your body is the infection of hair follicle by your Staph aureus. Okay, if boil occurs on the eyelash, Obviously eyelashes are also hair, right? And eyelashes also have hair follicles. If you get same thing in your lash follicle, you don't call it as boil, instead you call it as stye. Okay, this is very important. So if you get infection of your hair follicle, lash follicle, okay, by Staph aureus, you call this thing as stye. Okay, one more thing. In the lash follicle, you have the opening of duct of two glands. You have the opening of glands of Zeiss and glands of Moll. So with this thing, with the infection of the lash follicle, you also have infection, obviously, of the opening of these ducts, of like glands of Zeiss and Moll. So stye is the infection of hair follicle and associated glands of Zeiss and Moll, okay, by Staph aureus. This is the simple definition. Okay, that's why you see lash within the lesion. When there is pus inside the hair follicle, you classically see the lash in the lesion. Okay, because beneath that lash, the lash follicle is infected. I hope this is clear, because this is very important and they like to ask you this thing. Okay, what is the etiology? Stye is the acute suppurative infection of lash follicle and associated glands of Zeiss and Moll by Staph aureus. Stye is also known as Hordeolum externum. Okay, you can use any of the term. Okay, what is the treatment of stye? Okay, we ask the patient to apply warm compresses on the lesion. So this is a conservative type of lesion. Then we have medical type of treatment, in which we give analgesics, antibiotics that are effective against Staph aureus, classically penicillins and clavulanic acid. Okay, the combination of penicillin with clavulanic acid is very effective against Staph aureus. Then we give systemic antibiotics. Then we treat associated blepharitis. If you have inflammation of eyelid margin, whole eyelid margin is involved, okay, this is known as blepharitis. We like to give treatment for the blepharitis as well. Okay, so we had some surgical treatment options as well. I hope you have heard this thing. Whenever there is pus in your body, just drain it. Whenever you have abscess, just drain it. Okay, so what kind of methods do we have to drain the mucopurulent fluid present within the stye? We simply epilate this lash. Okay, just epilate this lash. When you epilate this lash, opening forms here, and all of the discharge, all of the fluid actually comes out of this lesion. Okay, and this is the one method. You actually epilate the lash, or you can even incise the lesion with a tip of knife. Just give a incision over here and drain all of the material present inside the lesion. Okay, so these are the treatment options. Okay, if you don't treat it, what kind of complications we can face? The patient can have preseptal cellulitis. Then the patient can have orbital cellulitis. And eventually the patient can have cavernous sinus thrombosis. Cavernous sinus thrombosis will occur as a result of ascending thrombophlebitis of vessels, of veins draining your eye, and your eye is drained by ophthalmic veins, right? When the ophthalmic vein drains this infected area, they will have infection, and that infection will classically cause ascending thrombophlebitis of ophthalmic vein, which will eventually when these veins will eventually drain into cavernous sinus, there will be thrombosis of cavernous sinus. Okay, so I hope this is clear. This is the favorite topic of examiners. They like to ask everything about it, and I hope you understood this well. If you have any kind of questions, just write them down in the comment section, and best of luck.